Poor nutritional choices and unhealthy lifestyles have led to diabetes being one of the fastest growing chronic diseases globally across all population groups as well. Understanding the condition and how it exactly affects the human body is an important step in fighting the disease. So joining me in studio is Dr. Prenitha Naidoo to share some advice on the holistic management of diabetes. But what we love about you is that you're able to take something complex and give it to us in the most simple form. We hear the word everywhere nowadays. Yes. Diabetes, I've got diabetes, I've been diagnosed. But I still find that people, when you actually dig deeper, they actually don't know what it is.
100%. I think it sounds like a simple condition, but it's actually so complicated.
It's very complicated.
More than people actually understand.
Yeah.
So what we're going to do is we're going to try to break it out in a nutshell, make it simple for people to understand. So basically what diabetes is we know that we need glucose in our body and it's floating through our bloodstream, and that glucose is used for energy. So when you have diabetes, your cells are not receptive to either the insulin that's required to uptake the glucose. You have an increased risk of higher than normal blood glucose levels. And that's simply what diabetes is. So you get two types of diabetes. So most people don't even know that. You get type 1 diabetes and type 2. Type 1 is known as insulin-dependent diabetes. So that's an autoimmune link to diabetes. So when we say autoimmune, we mean your immune system is attacking itself. In this case, the pancreas, which is that organ that's specifically responsible for production of insulin, becomes under strain, it starts attacking itself, and then the beta cells within the pancreas cannot release the insulin anymore. So hence why people then need to be insulin
themselves
dependent.
Right. And that's often diagnosed much younger than type 2 diabetes.
Correct.
Right?
So it used to be termed juvenile diabetes. You get it much younger. There's a genetic link to it, and often we mention that there's an autoimmune link to it. So type 2 diabetes happens much later in life, and it used to be more in the 40s. Now we see actually people much younger in their 20s developing diabetes.
Scary.
Yes, and that's due to lifestyle, right? So it's metabolic type of syndrome. So this is happening where your body actually, or the pancreas does produce the insulin, but then we start off with that insulin resistance, where the cells are not sensitive to the uptake of that insulin as well as it should be to process the glucose. And over time, that becomes more resistant, and we have the increase in the blood glucose causing the type 2 diabetes.
What are the symptoms? What would make one believe that perhaps they need to go and get tested for
So
diabetes?
first, what I would normally suggest is if you have a family history of diabetes, you've gone through a stressful emotional event, and you presenting with symptoms of either polyuria, which means increased urination, polydipsia, which is increased thirst, and polyphagia, where increased hunger. So you're noticing that you are eating more, you're urinating more, and you're more hungry, but you're not gaining any weight. And you're feeling fatigued, you're feeling tired, and you're also feeling like you can't get through the day. That's usually the first signs that I need to go and see what's happening with my blood sugar, or if there is a relation to possibility of it being diabetes.
Okay.
We also know that the huge link between diabetes and coronary heart disease, right? So if you have diabetes, you increase your risk of cardiovascular disease by almost 50%. So if you already have something going on cardiovascularly, chances of linking it to diabetes is much higher.
Where does that link come in?
So if you think about cardiovascular health and you think of what makes up your cardiovascular system, it is your blood vessels. And if we think of high levels of blood sugar circulating in those blood vessels over a long period of time, they start destroying the integrity of the blood cells. And that then increases that risk of cardiovascular disease like high blood pressure, cholesterol, stroke, because that integrity and the strength of vessels can't pump the way they used to previously because of being damaged due to the high levels of blood sugar.
So Alzheimer's is now being called type 3 diabetes as well.
Yes.
Why is that?
So if you think about what are the biggest concerns of a diabetic patient, over time, there's things like diabetic retinopathy, where there's damage to the eye. You see people suffer with neuropathy, and that's where we get Alzheimer's kicking in, right? So the damage,
degeneration.
Correct, the demyelination or breakdown. So you think of your nervous system or your nerves as being these cords that are surrounded by an insulation tape. And if you think of what happens with the blood sugar, it actually takes and frays away that insulation tape. So you leave those nerves that are now exposed, creating the neuropathy, but in the brain it's exactly the same thing. The same thing is happening where those nerves are not sort of synapting the way they should, and therefore the information is getting across, and therefore you're getting the sympathetic, parasympathetic response not as good as it used to be.
What else should people do in terms of testing to make sure they have an accurate diagnosis, not just for diabetes, but for insulin resistance as well?
I think the key is, especially with females, right? Hormones play such a big role, right?
Yeah.
We know that it's a vice versa type of thing, right? The PCOS, the insulin resistance, those kind of things. So I think there's a vast array of things. Don't just look at your blood sugar isolatedly. Don't just do a fasting glucose and saying, oh, my glucose is normal, it's not within range. So things like HbA1c, right? Which is actually what your blood sugar has been over a period of 3 months. That's more telling. It's telling us what your body has done. Is it higher than the 7 that we actually worried about, or is it lower than that? Okay, are you processing the sugar much better? So those kind of things. Also, you got to look at what is in your genetic makeup. So maybe, you know, genetic testing, right? So yes, my mom and dad have diabetes. Is there a possibility that my risk could be higher? And often it's better knowing what you're actually dealing with than dealing with it once it's there.
What about blood glucose monitors? You know, that was very interesting for me, just to see 2 hours post a meal, or even first thing in the morning after fasting between 9 and 12 hours. What was my blood glucose levels? You know, and someone like me, who I thought was quite healthy, it was actually showing that there may be cause for concern. Is that something that you recommend for some of your patients, or not really?
Look, it's called a random blood glucose test, and random is also based on what you've eaten. So it does freak people out a lot. So I can take an average patient and make them drink a glass of Coke, and
of
I
course,
tested 12 teaspoons of sugar in a glass of Coke. Your blood sugar is going to spike, right? It's going to hit that 9, 10 mark. And we know anything above 9, the immune system goes to sleep. That's why it's such a problem. So your white blood cells, your immune system cannot fight. So we worry about that type of marker. But does that mean that your body doesn't bring back down again? So it's what your body does thereafter, right? So most people that are diabetic will go up to the 12 and maintain the 12, and sometimes even go higher. Whereas an average person that can process the blood sugar better can drop. So yes, it's a good random indication if you are diabetic to actually see what I'm sitting in. Also, post-meal, if I've eaten something that's laced in carb or something that's really hard to process, what does my body do? Do I need to have less of that, and what size or portion amount am I supposed to have?
Okay, so stay tuned, because when we come back, we continue our chat with Dr. Prenitha Naidoo, and we discuss ways to manage diabetes naturally as well. We'll see you in a short while. If you've just tuned into the show, it is the end of Real Health, but we still have some valuable information left for you. We'll continue our chat with Dr. Prenitha Naidoo about diabetes and how you can manage it holistically. What happens if you don't control your diabetes?
So complications that result from diabetes, uncontrolled diabetes or undiagnosed diabetes, are 3 major things, right? One thing is called diabetic retinopathy, where the retina, the artery that actually supplies the blood to your eye, actually starts getting damaged because of that breakdown of all the sugar sitting there, and that can end up with blindness or visual disturbances. Then you've got diabetic nephropathy, which is affecting your kidneys. So decreasing the functioning of the kidneys, obviously you're not filtering correctly, and then you end up with a kidney disorder later, right? And then obviously diabetic neuropathy, which we mentioned, where you get the pins and needles in your feet, the nerves are then being exposed, there's the pain, and also, I mean, we know that some people actually end up with having their legs amputated, right? So that's also one of the complications. Are there also slow healing ulcers? Very few people actually know it, or wounds. If you get a wound that takes really long to heal and you can't understand why, you know, that's also something to look at. There's a possibility that there might be some diabetic.
You see diabetic compression socks on the market as well. Why is that?
So circulation is such an important thing, right? And we know that with people with diabetes, it's never isolated because it's a metabolic syndrome. So there will be a slightly higher than normal blood pressure. And we know that if you're not circulating and not getting that blood flowing as well as it should, you're actually getting pooling into that section. If you do, and that blood sugar is sitting there, it starts to attack those arteries, starts attacking those nerves, and then you end up with it not helping with the circulation, and then that's where you increase your risk of actually having amputation needing.
In the legs as well, or in the limbs.
Yes.
Okay, so what can people start doing to holistically treat the condition? And in your opinion, because this has been such a hotly debated topic for the last at least 5-6 years now, is it reversible?
So if you're in the pre-diabetic stage, it's always good to then check your blood sugar often. I always tell people, they're like, no, I don't want to do a random, but it is important to do it frequently, because then you can tell the difference from what was before to now. So if you're sitting in that pre-diabetic phase, yes, you can. And I have had patients that are in the diabetic phase, they can reverse it, right? It's a lifestyle condition. If you've gotten type 2 diabetes, it's your lifestyle. There's something I am doing incorrectly that I need to change. Stress is such a major factor. People don't realize what stress has and the effect that it has on your blood sugar. You think of that cortisol needing to be released because your body's in that fight or flight mode, and obviously the first thing you need for that is glucose. So now if you're sitting there, we're not processing that glucose, you're just dumping more into that blood vessels. So things like stress management is really important. Exercise is key. I mean, we mention this all the time, and I think people are sick of listening to it, but you know, you're getting that body to use that glucose, you're getting that body to actually burn it off, right? That's sitting there. So it plays such an important role. And we mentioned to people burst type of exercises. So 20, 30 minutes, you know, intense burst type of exercise. And if you can't, then start slowly and work your way up. Then we talk about diet, right? So I have a lot of patients that come to me that are diabetic and say, I've been on glucophage, I've been on metformin, I've taken insulin, my blood sugar still doesn't go down. And we break down their diet and they're like, well, nobody's ever told me that I need to not have fruit or so much of fruit or what type of fruit that I can eat or can consume. They don't understand that fiber is really important, and then carbs actually convert to sugar in your bloodstream, and you should reduce the amount of carbs. So diet is important, and I often suggest people to see a dietitian. You know, it helps to narrow down what you can eat and how much you can have. So if I do want fruit, how much of fruit can I have till it's actually not good for me, kind of thing, right? And then if you talk about from a natural point of view, so what can you do? So like, there's a lot of research that shows that a magnesium deficiency can actually cause diabetes. Okay, so magnesium is very important. If you think you are pre-diabetic or you think you have a family history of diabetes, or in general, we know how important magnesium is, right? And we think of muscles, we think of nerves, it feels all the important things. Stress. So magnesium, amazing. Chromium, really amazing. Lots of research of how it actually balances that blood sugar, actually controls the synthesis of it, helps the insulin sensitivity, so you uptake that glucose really well. So chromium. Other things like vanadium, also really good. Those really work really well in controlling blood sugar. Then we talk about a herbal point of view. So things like Janima, which very few people know of, Ayurvedic herb, works brilliantly at controlling blood sugar. Now this is all being monitored, right? So if you are on medicine already and you want to try and wean yourself or try to see how you can assist, do it in conjunction. So add in a bit of Janima and see what your blood sugar does.
Because there's medicine-induced deficiencies as well. If someone is on glucophage or metformin, there's a vitamin B12 deficiency.
Iron, vitamin B12. Right? And also you're not digesting really well if you're taking those. So then you're really not getting the nutrients that you require. So 100% digestive tract also needs an overhaul, right? So bitter melon, brilliant. Okay, there's a specific herb that's called nopal, which is actually a prickly pear, and also works, lots of research showing what it actually does to control blood sugar. So there's a plenty of things out there that you can do. Omegas, we know anti-inflammatory, we know autoimmune link, metabolic syndrome, you need the inflammation, cardiovascular protective. We also know linking it to other cardiovascular diseases.
Like a web actually in your body.
100%, like coenzyme Q10, we talk about it, right? Brilliant for the nerve, the neuropathy. And now you get coenzyme Q10s, you get things like PQQ, which actually work within the mitochondria of every single cell that actually help with energy, help with nerve regeneration. So those are kind of things you can look at if you have any complications related to the diabetes.
Because people that are on statins for cardiovascular complications can end up developing diabetes, and then
vice versa.
The medicine-induced deficiency from being on statins is coenzyme Q10. There's a deficiency in coenzyme Q10. So it's crazy that we're not seeing the full picture, although we're starting to paint that picture for people. But the minute you make one adjustment in one area, you can help yourself in other areas. 100%. One of the questions that's come in from our viewers is, why is it that my blood glucose levels are a lot higher in the morning? Now, obviously, it's a very difficult question for you to answer because there could be a whole host of reasons 100%. Around that. But just based on you being in practice and what you've seen over time, for someone that has been diagnosed as diabetic.
So I've noticed that it's quite often with a lot of diabetic patients, and it's depending on what meal they have at night, right? So diabetics are actually told to have a snack. They're supposed to eat 5 small meals throughout the day because you want to balance that blood sugar. If you're not having that 10 o'clock snack, you think of whether you're insulin dependent or not, and you're taking your pills at night, you're basically getting your body to lower that glucose that's circulating within your body. But as you're sleeping, there's still activities happening. Your metabolism still needs to work. So now, because you've lowered it to such a level and it has dropped, your body now needs to modulate that, right? So what it does is it does the complete opposite of that, which needs to upregulate that glucose. So when you wake up in the morning, because an average person, if they did that, their blood sugar would go to 5 or 6. But if you're diabetic, it's going to push it all the way up. So it just basically means that you're not managing it correctly when it comes to point of view of what you're eating. So then you should push or have a snack later at 10 o'clock. It'll actually help that blood sugar to regulate better.
And what types of snacks are good?
So
Because you want, slow release type carbohydrates. If you do choose where vegetable is good, but I don't know if people are snacking on vegetables.
100%. So like rice cakes are okay to have, right? Okay. Peanut butter really, so protein-based stuff. So your peanut butter, you could have a little bit of peanut butter on a rice cake. It doesn't have to be much. It might just be a little bit. You could do your carrot sticks, and I know people don't want to snack on that, but I mean with hummus or tahini or that kind of thing. So you want to have exactly what we're saying, low glycemic index, something that
actually... You don't find that rice cakes are a little bit too high glycemic index?
So they can be, but it depends on which type of rice cakes you're having, right? So it's also got to do with what you're going to have at what specific time.
And what you're combining it with.
Correct. So protein, if you're adding the protein to it, so that's why I was saying peanut butter, so that obviously makes you digest it a little bit better and makes it work over a longer period of time.
Okay, fantastic. Well, I mean, are there any other tips that you have for our viewers that, have been diagnosed with diabetes or have family members that have diabetes, just as final thoughts from you?
I think the most important thing I can leave people with is just, don't be afraid of having diabetes. I think that's the biggest thing. People are like, oh my word, I actually distance myself from the diabetes. I'll just take the pill. Don't. There's so many things that you can do to modulate and change. It's just understanding what you were doing, understand your diet better, and just live a balanced sort of lifestyle. I think that's the key to getting diabetes under control.
Awesome. Thank you so much for joining us and just shedding some light on what is really a complex condition.